This is Community CloseUp with Jay Dow.
Removing the mentally ill and homeless from our streets and subways against their will.
So where is he going? He's going to Bellevue? He didn't want to go.
Yeah, he did want to go.
Is this a matter of public safety, or is the Adams administration crossing a line? And new routes, new tolls. What you and your wallet need to know now that congestion pricing is finally here. Our Greg Mocker breaking things down. Also ahead, our community, your voice. Animal lovers, listen up. How a puppy-friendly nonprofit on Long Island is giving the gift of sight and friendship to the visually impaired, free of charge. Welcome to PIX11 Community CloseUp. I'm your host, Jay Dow. Thanks for being with us. We're starting with public safety in the subways. It doesn't matter whether you take the train into the city from the suburbs or live and work in one of the boroughs. The mental health crisis has changed how we move around the city, how often we decide to take the subway, and how tense, concerned, or frightened we feel when we're down there. That brings us to the issue of involuntary removals. That is, taking someone out of the subway against their will, even if they're not in any obvious mental health crisis. We recently went underground to see exactly what that looks like and pressed a high-ranking city official about this controversial policy. This young man, homeless and disheveled, surrounded by a joint response team made up of 2 NYPD officers, a social worker, and a nurse. After protesting for several minutes, the handcuffs stay on, one of the many involuntary removals the Adams administration conducts on a weekly basis in the New York City subway system. After several minutes, the man is led out of the station, up to the street, and into a waiting ambulance.
So where is he going? He's going to Bellevue?
Headed to Bellevue Hospital for a psychiatric evaluation. Evaluations which often lead to an involuntary 72-hour psychiatric hold.
He didn't want to go.
Yeah, he did want to go.
The team's nurse going along for the ride.
There has been a pervasive misunderstanding of the law in New York.
Brian Stetton, the mayor's senior advisor on severe mental illness, says response teams perform about 130 involuntary removals a week under a broader interpretation of the prevailing legal standard that determines whether a person is a, quote, danger to themselves or others. It's a direct response to the public's palpable concern over innocent people being victimized above and below ground. From suspect Ramon Rivera, who police say fatally stabbed 3 innocent victims in unprovoked attacks across Manhattan, to Sebastian Cepeda, who's accused of walking out of a homeless shelter and then fatally setting a woman on fire as she slept on board an F train in Coney Island, Brooklyn.
To recognize that a person who cannot meet their basic needs for food, clothing, shelter, or medical care, those basic human needs, because of that mental illness interfering with their addressing those needs, that person's a danger to themselves, even if the risk to them is not imminent.
Under that broader interpretation, the response team also approached 63-year-old Daryl,
Well, I've been on speaker for a period of time, about 15, 20 years.
who was lucid, did not appear to be in any kind of mental health crisis, and told us he has access to a bed in a facility.
You don't like staying there?
No, I ain't dead. I get tired of staying in the house. I'm an ex-drug addict.
Daryl's preference, the warmth and anonymity of the subway system. The reality is both Daryl and the man who was involuntarily removed minutes earlier will likely be back down here in the subway system in a matter of days. A function, critics say, of what amounts to a revolving door of short-term treatment.
In the situations where, let's just say, this gentleman who you involuntarily removed is sent to a supportive housing environment, does not want to be in that environment, ends up coming back down here in the subway, and then disappears from this spot and is roaming the city, how do you catch up with that person?
No, so that's a great question, and I think what it comes down to is what you're describing is someone who actually is not ready for discharge from the hospital.
But am I wrong in saying that the system as it exists right now does discharge that person?
You're certainly correct that we've done that a lot historically.
In the worst cases, there are devastating consequences for a system's failure to find, keep track, and successfully help someone experiencing mental health issues. Stanton acknowledges it's a difficult situation.
one of the important pieces of how we're trying to change the culture of the system is to have it be understood by people making those decisions at hospitals, doctors who are deciding whether to retain or discharge a patient. It has to be about more than how they are presenting in that moment.
You may have noticed a more militarized presence in the subways these days. Compliments of Governor Kathy Hochul, at least 250 additional members of the National Guard acting as, if nothing else, an added deterrent. Take a listen.
We're reinforcing the numbers to have that sense of security that every New Yorker and visitor deserves to have. I just want anyone to know, if you're thinking of committing a crime on the subway, we're watching and you will be caught.
Social workers partnering with police, involuntary removals, National Guard soldiers in the stations. The question is, what is the real impact on public safety for you as you're standing on the platform or riding on the train? Joining me now, New York City Deputy Mayor Ann Williams-Eisen and Norman Siegel, former executive director of the New York City Civil Liberties Union and co-founder of the Street Homeless Advocacy Project. Thank you so much for joining us, both of you.
Thank you.
So let me start with you, Norm. You've had a lot of hats in your career. Is the presence of National Guard soldiers in the subways taking the city in the right direction?
I don't think so. I think that they took their resources and their focus and devoted it to dealing with the systemic problem, which is where are the community mental health facilities, where are the programs, single rooms, housing with support services. That's the way to deal with this issue systemically. And we haven't done it for 40 years.
Deputy Mayor, this is not a local initiative. This is from Governor Hochul. But let me ask you, is this sustainable? And is this the right policy?
I think that the mayor has been looking at this as a holistic problem. This hasn't been solved before. We are looking at a lot of different aspects.
Is the National Guard part of that solution, though?
I think, I was just talking to my family. I'm raising 3 young people in New York City, my children who are in their 30s. And I think sometimes when they see the National Guard there, they feel safe. Do I want National Guard in every single, subway station and that to be the sustainable solution? I think that we need more than just National Guard.
You touched on that. Is the policy of sending social workers down into the subways partnered up with police officers to involuntarily remove someone from the subways if necessary, is that crossing a line?
I think so. First of all, the National Guard, or as we have in New York City, the NYPD, those are the people that are not trained to determine whether someone is a danger to themselves or others. The key is winning the trust of the people out on the street. When I go out there, since overwhelming, also people don't want to recognize, there's racial overtones to this. When I go out there, I'm a gringo. Why should some young black man or older black man all of a sudden trust me when they don't even know who the hell I am?
Well, as it stands right now, there are police officers who are outnumbering the social workers. In fact, that involuntary removal that took place, it was the last of the night because the nurse had to go with that person to Bellevue.
Right.
And
the cops
they weren't able to do any more.
Had to do this.
But the purpose, I think we're trying to act like there's one solution to a very complicated issue. I agree with Norm.
I agree with that.
Right? I agree with Norm that engagement is the key to this. What I'm saying, though, is sometimes people are so severely mentally ill that they don't realize that they need that help, that they're not making their basic needs. I'm not even saying that they're a danger to themselves or others, but they're not feeding themselves, they're not sheltering themselves, and I just don't feel comfortable leaving them there. And so I do think that there needs to be a continuum of solutions.
If you focus on voluntary, getting people off the streets, you'll identify the people who need to be involuntarily committed and meet the constitutional standard. The Supreme Court 50 years ago in a case said that if someone is involuntarily committed, that's a massive deprivation of their right to liberty under the 14th Amendment. Yep. The standards that they're talking about, they're vague. What is basic survival needs? Under their 4 points, one of them is food, clothing, and shelter. 5,000 people tonight under that definition can be involuntarily picked up. So they have to rethink the standards and get it so that it's imminent, it's real, it's not speculative or abstract. Then if you have people, and it's a small percentage, we'll get them out. We won't have people like a woman who gets burnt on the F train out in Coney Island.
I want to stop it there. Ann Williams-Eisen, Norman Siegel, let's pick up this discussion. There's a lot to talk about. Stay with us. We'll be right back, right after the break.
You're watching Community Close-Up with Jay Dow.
Wherever you land on the debate between public safety and civil rights, there's no denying the fact that Mayor Eric Adams has drawn a clear line in the sand on this issue.
We made a big mistake years ago when the advocates were complaining about closing down our psychiatric wards and facilities like the Creekmoors and the Kings Counties and others. There was a big push. We closed it down, and many people went to the streets. There was nothing for them. We need to get back into thinking about long-term care. There's some people who may never be able to live on their own, and we have to be honest about that.
Back with New York City Deputy Mayor Ann Williams-Eisen and Norman Siegel. Let's talk about follow-up, because you heard the mayor talk about people who may not be able to live on their own, and we talk about a group setting where people are given the meds that they need. But my question to Brian Stetton in the piece, and the question to you now is, how do you make sure that you're following up with someone who has received their meds, but then they're back out into the city, they're in the subway system, they may not be where you originally found them?
Yeah, I think I want to go back to something that Norm just said in terms of the laws being vague. And I think one of the things that we want to look at and we're putting forward in the Supportive Intervention Act is how can we get clarity on what some of these standards are? People do not lose their due process rights. I agree with you 100%. And it is precious to take away somebody's freedom. So we want to make sure that we are clarifying what the standards are. We want to make sure that we're having a totality of people's their treatment over time, because sometimes people present and they are okay, and then a couple of months later they're not. We want to make sure that we can engage with them.
So how do you find that person?
We have doubled our outreach workers. We have an idea about creating a specialized shelter where we can have people have individual rooms and be able to keep an eye on them until we're ready to transfer them to treatment. So I think there's many things that we can try, Jay. And again, the status quo is not sufficient, so we want to try as much as we can.
Norm, where do you stand on this?
It's a public crisis. So for example, we've suggested, state and city has moved on it, public crisis, use eminent domain. Take over some of the vacant hotels throughout the city, especially post the pandemic.
I think both of you have a lot of common ground where you agree. I'm going to be the voice of the person who's just on the platform or on the train. They're seeing what's coming down on their news feed, and they may be scared. I guess at the end of the day, people just want to be safe when they're down there in the subway.
And to the point, we do more voluntary removals than we do involuntary removals. Last year, I think it was 8,000 people we were able to connect to shelter, and 2,000 to, like, we're out there doing that work. But there are certain circumstances, and I think those people have an inordinate effect on us when something happens. And I do think that working together with the city, with the state, and with our nonprofit partners, that we can make a difference.
We're going to leave it there. Deputy Mayor Ann Williams-Eisen, Norman Siegel, co-founder of the Street Homeless Advocacy Project. Thank you so much for coming out to talk about this important issue.
Thank you,
Thank
Jay.
you. Thanks, Jay.
Coming up, we're pivoting from the subways to your wallet with new information on what you need to know about the new congestion pricing. Stick with us. That's right after this short break. After a year of legal challenges, dueling news conferences, shouting matches, and false starts, congestion pricing is finally here, and it's definitely going to take some time to get used to if you're behind the wheel heading into the congestion zone. I'm not even going to attempt to dissect all of these details, which is why I asked my buddy Greg Mocker to come in and explain it to us all.
I think we'll still have some shouting and some disagreements and some clapping. Transit advocates certainly happy to see this moving forward. Drivers still having some concern. So here's how it works. All vehicles driving below 60th Street will be automatically charged when they enter it, unless you stick to the FDR and West Side Highway or go straight from those roadways into the Hugh L. Carey Tunnel. all of those routes are considered to be outside the zone. But then the minute you turn onto any local street or cross street, you would get charged there. As far as how much this will cost you, that all depends on a number of factors, including whether you're traveling during peak or off-peak hours. Peak fees will be in effect from 5 a.m. to 9 p.m. on weekdays and 9 to 9 on the weekends. That peak fee will cost Easy Pass drivers $9 or $13.50 if you pay via tolls by mail. Off-peak Easy Pass regular vehicle drivers, $2.25 or $3.30 if you're using tolls by mail.
Greg, how do you memorize all that?
Well, I have it written down.
You must be dreaming about this stuff.
I have been thinking about it for a while, as have a lot of people. But, you know, this is something that will fund the transit system, a dedicated stream, and then also reduce congestion. At least those are the goals they tell us.
So for the people who are on the other side of this, driving in, how do they save money?
You can do that kind of by certainly watching that peak time. You save money with a tunnel credit. That was a big issue. There are some discount plans and exemptions. Drivers with an Easy Pass who enter the congestion relief zone during those peak travel times at any of the crossings are eligible for a credit, any of the tunnel crossings. So if you go in through the Lincoln or the Holland tunnels, the other tunnels, the Midtown tunnel, you get $3 off that congestion toll. You get $1.50 off if you enter or exit via the Queens Midtown tunnel, since that's one each way, or the Hugh L. Carey tunnel.
Got it.
As that goes there. Here's another kind of note on one of the things for the low-income drivers. They'll catch a break with a 50% discount, but that goes into effect after the first 10 trips in a calendar month. But to get that, you must be enrolled in the low-income discount plan, and that sets an income level which is about $50,000.
So 2 weeks before you start to receive that discount?
Yes, after a certain number of trips there. And they're going to see how a lot of this works. The MTA will be reviewing it, be letting us know. I'll certainly be asking about it. Adjustments will be made. We'll see how it goes.
I know you will. Greg Mocker, the man, the legend.
Thanks for having me.
Thank you. Appreciate it. Coming up, how an incredible nonprofit raising guide dogs with training that costs tens of thousands of dollars and pairing them up with the visually impaired. It's a great way to end the show, and you'll see it right after the break. For so many of us, our pets are our family, and for millions of people who are visually impaired, guide dogs are also lifesavers, allowing for a full and clear path toward a livable future. But getting a guide dog can be incredibly expensive, with training costs up to $50,000. But what if we told you there's a nonprofit on Long Island doing all of that hard work, creating those lasting bonds free of charge? Colorama has more in our latest heartfelt edition of Our Community, Your Voice.
This is Maddie. She's a female black Labrador retriever. Steady.
Maddie is a guide dog.
Maddie, right curb.
And that means she goes everywhere with Yi Fan.
I cannot see the obstacles at all, so I'm relying on her to make sure I don't run into any of them.
Yi is legally blind. Outside in the bright sun, Yi can't see at all. Her vision is slightly better indoors. She was born with a condition called oculocutaneous albinism. With a cane or an obstacle finder, there's a chance Yi could walk into something. But Maddie avoids the obstacles, as you can see.
Maddie really helps me because if I'm traveling, it's so much easier than using a cane, and I can get from point A to point B a lot faster.
And as a 20-year-old nursing student at Malloy University, Yi keeps a busy schedule, walking at a rapid pace with Maddie by her side.
It's a hard 12 hours, and like my eyes get tired by the end of it, and she helps.
That's all part of the extensive training for both Yi and Maddie. Volunteer puppy raisers have the dog from 8 weeks old to 14 months, teaching the pups house manners.
They are really incredible. You get so much more back, I feel, doing it than what you're putting in. I really, because you do love them.
After that, the canine graduates to a guide dog mobility instructor. Mark Briganti has trained more than 200 dogs over 20 years, including Maddie.
We have 12 weeks approximately, depending on our schedule, to make guide dogs out of them.
Briganti works at the Guide Dog Foundation in Smithtown, where guide dogs are trained free of charge. The Long Island campus is where he helped Yi with an intensive 2-week training to make sure Maddie matched her fast-paced life. The success often makes him emotional.
This is the crux of why anybody would do this job. As you can imagine, it's not a glamorous job. It's not, you're outdoors in the cold and the rain and all that. And you see somebody like Yi working as hard as Yi works. What this young lady's done with her dog is just incredible.
For Yi, it's just the beginning on a path of paying it forward. For Community Close-Up, I'm Kalorama.
Great work with great dogs for great people. You know, we're reading your messages and emails. If you have a story that you think we should know about, keep them coming. Email us at communitycloseup@pix11.com. On behalf of the entire Community Close-Up team, I'm your host, Jay Dow. Thanks so much for watching. See you next time on PIX11 Community Close-Up.